views, opinions, and presentations of the guest are not intended to establish a standard of care to be followed by the audience. Always seek the advice of your physician or other qualified healthcare provider with any questions or concerns you may have regarding your health. Furthermore, the assumptions, views, opinions, and insinuations made by the host and guest do not reflect those of the show and the management. Zach at Zydus brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.
Hello and good day to all of you. My name is Fort Sagabay and welcome to another episode of Health Talk, your weekend source of good talk on good health. Salamat po sa pagsama ninyo sa amin ngayong hapong ito. Ngayon po ay araw ng Sabado, August 22. And I hope that all is well with you guys. Sa ating mga Facebook Live viewers from all over the country, good afternoon po sa inyong lahat, lalo na sa mga doctors na nakikinig at nanonood ngayon. Today, another exciting and learning field session ang ating matutunghayan. Ikaw ba ay may kilala o may kasama na may epilepsy? This afternoon, aalamin natin ang mga haka-haka o myths, katotohanan or facts, mga dapat at hindi dapat or do's and don'ts in epilepsy. And now to help us understand this topic, we have invited a health expert. Siya ay walang iba kundi si Dr. Jean Marie Ajoro. Si Dr. Ajoro ay nagtapos ng medisina sa University of the East Ramon Magsaysay Memorial Medical Center or UERMMMC. And then she continued her residency in pediatrics and fellowship training at the Philippine Children's Medical Center Child Neurology. Furthermore, she finished fellowship in demyelinating diseases in children at the Hospital for the Sick Children or Sick Kids in Toronto, Ontario, Canada. She is currently the president of the Philippine League Against Epilepsy and immediate past president of Child Neurology Society of the Philippines. And now she continues her practice sa Fonte Children's Clinic in Calamba at the PCMC in Quezon City. So we're glad to have you with us today. Thank you so much for accepting our invitation. Good afternoon, Dr. Jean Ajoro.
Hi, good afternoon. Good afternoon, Fortune.
Yes, good afternoon, Doctor. Welcome to Health Talk.
Yes, well, I'm glad to be here. Kamusta?
Well, it's been a roller coaster ride in the past 3-4 months. Ang daming mga nangyayari, Doctor, sa ating environment because of what's happening din sa current situation, no? Not only in the Philippines but also across the globe. So we're glad to have you with us once again, Doctor, to talk about the facts, the myths, the do's and don'ts in epilepsy.
Okay, so we'll proceed with the talk now. Okay na tayo. Yes. So let me start this talk with this quotation from Maya Angelou. You may not control all the events that happen to you, but you can decide not to be reduced by them. So this does not only pertain to epilepsy, but it also pertains to maybe our situation now, no? So to get started, marami sa atin ang nagtatanong, ano nga ba talaga ang epilepsy? Okay? Ang epilepsy ay isa sa pinaka-common na neurological disorder that can affect people of all ages, no? Hindi lamang bata, hindi lamang matanda. At kadalasan ng epilepsy ay isang kondisyon kung saan nagkakaroon ng mga unpredictable seizures and it can cause a lot of other health problems. It is actually a condition na that can present with a wide range of seizure types. Hindi lamang kasi a lot of misconceptions sa kala nila pag sinabing epilepsy, yung lamang nangingisay, tumitirik ang mata. But it's not limited to that only, no? There are a lot of seizure types, and usually the its type and control usually vary from person to person. Unfortunately, in epilepsy, there are a lot of misunderstandings. No? Kadalasan, yung mga misunderstandings na yon, mas malala pa at mas challenging kesa mismo doon sa kondisyon. So just to give some points of clarification and definitions, no, ang seizure at ang epilepsy ay hindi pareho. Ang seizure is a transient occurrence of signs and symptoms, no, and this is usually due to the abnormal, excessive, or synchronous neuronal activities in the brain. Problema po ito sa daloy ng kuryente sa utak natin, no. Whereas ang epilepsy, ito yung karamdaman. It is a disease that is characterized by an enduring predisposition to generate epileptic seizures. No, and it is defined by a lot of factors, be it neurobiological, can be cognitive, psychological, and social, and it can have social consequences. So, ang seizure ay yung event o yung simptomas, ang epilepsy, yun yung disease. Okay? So, para lang malinaw po para sa ating lahat. Okay? So, a person is considered to have epilepsy if they meet any of the following conditions. Dapat nagkaroon siya ng at least two unprovoked, no, seizures, meaning walang dahilan, bigla na lang siya nagkumbulsyon. No? Wala siyang lagnat, walang anything. Tapos, these two events should occur greater than 24 hours apart. No? So, and then, or it can be that there's only one unprovoked seizure, but the probability of it happening again, no, is very high, no, and can occur over the next 10 years. And even if the person had one seizure, but by working that patient up, fulfills a criteria for an epilepsy syndrome, then the patient may be diagnosed to have epilepsy. So how do we classify epilepsy? The latest classification na sinusundan natin was published by the International League Against Epilepsy in 2016, no? And here is that classification. So your seizures can be focal. Ang pinaka natin dito, I think what I need to emphasize here is yung onset ng seizure, no? Kailangan importante na more or less ma-document o ma-describe ninyo sa doktor ninyo yung onset ng seizure. It can be focal, no, meaning pwedeng ang tawag dito, it can be atonic, myoclonic, clonic, no. These are the descriptions of the different seizure types, no. Na kadalasan pag sinabi mong focal, nanggagaling lang siya sa isang parte ng utak, kaya usually ang manifestation niya hindi yung buo na nakikita natin tumitirik ang mata, nangingisay yung buong katawan. It can happen that it can just be a twitching of the face. Pwede rin na nakatulala lang siya. Meron din naman yung sensory na tinatawag, nakakaramdam lang siya ng sensations na, for example, parang feeling nga may gumagapang sa balat niya pero wala naman, no? Sometimes it can manifest as that, or it can be an emotional outburst na usually wala naman siyang dating ganun pero bigla siyang nagkakaroon ng mga sudden changes in her emotions, no? And pag focal, ma-differentiate din natin, kailangan din natin ma-differentiate kung nagkakaroon ba ng pagbabago sa awareness ng tao. Kasi pwedeng mangyari na kahit na may seizure ka, especially if it's a focal seizure, intact pa rin yung awareness mo. Ibig sabihin, nakakaintindi ka pa rin, nakakausap ka, pero nagkakaroon ka ng mga manifestations ng seizures, no? And these focal seizures, eventually, pag nagtagal, pwede rin siyang maging generalized, no? So, pwede siyang mag-evolve from focal, magiging generalized. Another type of seizure are your generalized type. And here are some of the examples of your generalized seizures. And last, yung unknown onset. Sabi ko nga kanina, importante na malaman natin kung paano nagsimula. No? So, pag unknown onset, hindi na mai-describe sa atin nung nakakita paano nagsimula yung seizures. But we will just surmise through the description that they give us. No? And there are some seizures that can also be unclassified, meaning despite the characteristic na i-describe sa iyo, hindi mo pa rin ma-classify kung focal ba siya or generalized siya. Okay? So, ito lang yung listahan ng mga bagong seizure types that came along the way at na-include dun sa bagong classification. I will not deal much from this because usually it's going to be your doctor's gonna describe this to you and tell you what type of seizure you have basing on dun sa mga description na binibigay ninyo. Isang advantage siguro natin sa ngayon as compared sa mga sinaunang panahon, halos lahat po ng tao meron na silang mga smartphones, no, that can have a video function, and very important na armamentarium ito para sa ating lahat. If you can videotape, no, yung atake, mas maganda po because it will ease, no, and it will help your doctor distinguish more or less what kind of seizure your patient is having. So this is part of the manuscript of the classification. So kaming mga doktor, after namin ma-distinguish kung anong seizure type, no, i-classify natin siya kung magfo-fall under epilepsy siya. Or through some workups, no, malalaman din natin kung pwede natin siya i-classify into an epilepsy syndrome, and this will also help, no, kasi by classifying it, we can also help prognosticate, no. After natin malaman kung ano yung seizure type at saka kung anong klaseng epilepsy meron siya, ang next step is hanapan natin ng etiology. Hanapan natin ng dahilan. Bakit sila nagkaroon ng seizure in the first place? There are several etiologies of seizures and epilepsy. Nandito pumapasok yung genetics, no? Ibig sabihin, nasa genes mo yung nasa genes mo yung na propensity to develop seizures. It can be structural. Pag sinabi natin structural, there is something anatomically wrong with your brain, no? It can be, let's say, for example, nabago kang ulo mo, nagkaroon ng dugo, nagkaroon ng peklat dati. So, magkakaroon yan ng structural change sa utak mo. Yung mga pasyenteng na stroke, no, magkakaroon ng either ischemia doon or maaring magdugo, and yon structural yon. Or it can be metabolic. The metabolic causes usually ito yung mga pagbabago sa mga chemicals sa loob ng katawan natin. It can also be immune mediated at pwede rin siyang infectious. So kadalasan yung mga pasyente may meningitis or infection sa utak, no, na they can also manifest with seizures, no. And in a lot of in the majority of cases actually, hindi natin malaman or unknown yung cause ng seizures nila. Isa pa rin siguro nga emphasize nitong bagong classification is ang epilepsy, maari ho siyang magkaroon din ng comorbidities, no? Ibig sabihin nito, may mga kondisyon na pwedeng makasabay sa epilepsy nila, no? Especially since epilepsy is a chronic condition, isa sa mga common comorbidities nito are yung mga psychiatric problems gaya ng mga anxiety, depression, no? And we as doctors, as well as you as patients, should understand that this can happen simultaneously with your epilepsy. And kailangan po sa mga pasyente, dinidisclose nyo po sa doktor ninyo, no, yung mga nararamdaman ninyo bukod lamang doon sa mga atake ninyo. No? Kasi these are conditions that can be addressed as well by your doctors. And the doctors then, importante rin na naghahanap tayo ng mga signs and symptoms pertaining to these conditions that can be a comorbid condition together with your epilepsy. So isa sa common no, na tanong sa atin, actually madalas kami nagtatanong, ang epilepsy ba, nare-resolve ba yan? May mga tao bang gumagaling from epilepsy? No? Epilepsy is usually considered resolved no, for individuals no, na meron yung tinatawag nating age-dependent epilepsy syndromes no, na nalipasan na nila yung age no, kung saan applicable yung epilepsy syndrome nila no. So they usually after several years no nare-resolve on its own, nawawala na yung mga atake nila to the point na they don't even need to be put on medication no. Epilepsy is also considered resolved kapag naging seizure free ka na for the last 10 years no, na wala kang seizure medication for at least 5 years no. So it's considered resolved. Pero dapat din natin maintindihan na hindi ibig sabihin na pag-resolve na siya, garantisado na hindi na babalik yung epilepsy nila. No? Ang ibig lang sabihin nito, lumiliit na po yung tsansa na magkaroon ulit o bumalik ulit yung kanilang atake. But it's not a guarantee na pag na-resolve na, let's say seizure-free ka na for the last 10 years, you're off medications na for the last 5 years, hindi ibig sabihin nito na garantisado hindi na uulit yung atake mo. Because there are some na umuulit at umuulit pa siya. No? So, ano kadalasan ang nangyayari kapag ang tao ay nagkakaroon ng seizure? No? Gaya ng nasabi ko kanina, your seizures can take many different forms. No? And usually, the seizures can also affect different people in different ways. So, hindi sa lahat ng pagkakataon na pare-pareho ang klase ng atake ng bawat tao. No? So, every person with a seizure will not have usually yung lahat ng classical manifestations nito. For example, madalas natin naririnig, ay nagkaroon ako ng aura. Yung aura is usually a warning sign or is usually the first symptom of a seizure. No? And it is considered also a part of the seizure. However, you have to understand that not all people, like I mentioned earlier, will experience this aura. Ang kagandahan lang paminsan nitong nagkakaroon sila ng aura or warning signs na prepare ng pasyente na kumbaga i-protektahan yung sarili niya. For example, nakatayo siya, may nakaramdam siya ng aura, pwede niyang yung sarili niya na umupo siya kasi alam niya dadating yung atake. That way, mapoprotektahan natin na hindi siya bumagsak o mabagok ang ulo niya or something like that. So yun yung kagandahan paminsan na may aura. And then yung pinaka-seizure proper or your ictal phase. No? Ito na yung nagko-correlate dun sa sudden surge of a lot of abnormal electrical activities in your brain. So yun na yung seizure per se. And then after that seizure, magkakaroon tayo, ito usually yung end stage is your post-ictal phase, kung saan ito na yung simula na siyang nagre-recover. No? But you have to understand, gaya ng nasabi ko kanina, yung recovery period, it can be immediate for other people, pero yung iba, sometimes it takes several minutes or it takes even hours no, before they can feel like their usual self. So, sino-sino ba ang mga taong pwedeng magkaroon ng epilepsy? No? In one of my first statements, I said, your epilepsy no, can develop in any person at any age. No? However, they are usually more common among young children and in older individuals. In fact, 1 in 26 people can develop epilepsy in their lifetime. No? And people with certain conditions may also be at greater risk. So each year, about 48 out of 100,000 people may develop epilepsy. And according to the Center for Disease Control, no, at least 3.4 million in the US live with seizures, no, including 470,000 children. Sa Pilipinas, ang approximate prevalence niya is about 1 million Filipinos are affected with epilepsy at any given time. And anywhere in the world, there are about 65 million persons with epilepsy worldwide. So, ito kanina, I think, Fortune, you were also asking me about this, no? What causes epilepsy and seizures, no? The causes of epilepsy usually vary by age, no? Some people with no known history or cause of epilepsy may have a genetic form. Ito yung sabi natin kanina. Unfortunately, sa ibang bansa kasi available na po yung genetic testing. Sa atin sa Pilipinas, we are still in the early stages, wala pa po available sa atin na genetic testing, no? So that is the reason why maybe a lot of our patients then unknown pa rin yung causes ng kanilang epilepsy, no? And about 3 out of 10 people have a change in the structure of their brains that can cause these electrical storms, no, that can lead to seizures, no? Some young children may be born with a structural change in the area of their brain, and this can also give rise to seizures. Ito yung mga tinatawag nating congenital malformations. And about 3 out of 10 children na mayroong autism spectrum disorder may also have seizures. So, what causes epilepsy and epilepsy seizures? These are additional causes, infections of the brain. These are also common causes. Na-mention ko na yan kanina, no? Yung mga meningitis, encephalitis, no? They may manifest with seizures as well, no? People of all ages can also have seizures secondary to head injuries, no? However, usually mga severe head injuries, usually they often happen to mga young adults, no? In the middle age naman, strokes, tumors, and injuries are also a more frequent cause. And in people over 65, apart from stroke, dementia and Alzheimer's may also be a cause of seizure. So medyo elaborate lang natin ng konti itong different causes ng seizures, no? So, and we'll do it by age. Usually in the newborns, so sabi nga natin, di ba, at any age group. So kahit mga bagong panganak, pwede po tayo magkaroon ng seizures, no? Kadalasan ang sanhi ng pag-seizure nila are brain malformations or congenital malformations of the brain. Yung lack of oxygen during the birth process, yung tinatawag nating asphyxia, no? Po dahil sa mga bababang levels ng mga chemical nila sa katawan, gaya ng blood sugar nila, calcium, no, and iba pang mga electrolyte problems. It can also be secondary to inborn error of metabolism, no. Usually, ano rin yan, a lot of this inborn error of metabolism are also predetermined by genetic causes. Pwede rin naman din pong intracranial hemorrhage secondary to, yun nga, difficulty during the birth process, no? And another notorious cause can be maternal drug use, no? Yung mga nanay na nagtitake ng mga illicit drugs during the time of their pregnancy. Ano, this can induce seizures, or this can be a cause of seizures in the newborn. Sa mga mas nakatatanda, mga infants and children naman, fever is one of the most notorious cause of seizure among infants and children. Other causes can be brain tumors and then infections of the brain, gaya ng meningitis, no? In older children and adults, pwede rin mga congenital conditions like yung Down syndrome, tuberous sclerosis, no? It can also be genetic and progressive brain disease. like mga Alzheimer's, dementia, and of course, number one then is yung head trauma. Sa mga mas nakatatanda pa, mga seniors, na-mention ko na to, stroke, trauma, Alzheimer's are common causes. So, kadalasan, no, ano ho ba usually yung nagtitrigger ng seizures, no? In patients who are already predisposed, no, seizure triggers are factors that can precipitate or provoke seizures, no? And they may make a person with epilepsy more likely to have seizures in certain situations. Kahit controlled na sila, but when they are exposed to these triggers, pwedeng magkaroon sila ng mga breakthrough seizures, no? And this could change the number and the severity of their seizures. So, learning if you have triggers can help you learn what to do next, no? And modifying your lifestyle or your environment usually can lessen the risk of these triggers. So here are some examples of seizure triggers. Number one is your missed medications, no? Kapag hindi nyo po iniinom ng regular yung gamot ninyo, malaki pong chance na pwede po kayong magkaroon ng mga breakthrough seizures, no? Isa pa po dito yung lack of sleep or yung hindi magandang tulog, yung disrupted sleep na tinatawag po natin. They can also trigger seizures, no, in those patients who have predisposition to develop seizures, no. Illness, whether it is with fever or without fever, that can also cause that can also trigger seizures. Psychological stresses can also cause seizures, no? And of course, yung mga heavy use ng mga illicit drugs, alcohol, no, smoking, yung mga over-the-counter drugs, no. So it is also important that before you take mga over-the-counter medications, you have to clear it first with your doctors, no. If it is safe to be given to you, especially if you are taking medications for seizures, because it might have some drug interactions, no. And sometimes isa sa manifestation nitong mga drug interactions is increase in the frequency of your seizures. Okay? Other seizure triggers also include nutritional deficiencies. Lalo na kami sa child neurology, we really emphasize good nutrition, ano, among our patients, no? Kasi kung undernourished ka, hindi rin maganda yung nutrition ng brain mo, then it compromises these patients to more seizure. Yung mga poor eating habits, lalo na yung mga nagpapakagutom. Common ito usually among teenagers na babae where they are very conscious about their figures, ayaw nilang tumaba, so nagmi-miss out sila ng kanilang mga meals, no, without even telling their parents kasi gusto nila maging sexy, gusto nila maging attractive. That's understandable, no? But of course, you have to understand that, you know, fasting brings down your blood sugar and this can actually trigger a seizure event. Again, common din sa mga babae, pag nagkakaroon na when they reach adolescence, no, nagkakaroon na ng mga hormonal changes, no, andyan you start your menstrual cycle, and sometimes having your monthly period can trigger seizures, no, in some patients. Another thing that can trigger seizure would be flashing lights or patterns, no? If you remember several years back in Japan, nagkaroon yung tinatawag natin na Pokemon seizures, no? Nung nauso yung mga Pokemon series sa TV at saka yung mga games na Pokemon, dahil dun sa varying intensity ng lights na nagfi-flicker dun sa screen, there were some patients na nag-induce na-induce yung seizures nila. Other triggers would also include specific activities, even noises, or even the smell of food can trigger seizures in some patients. Isa pang madalas na katalungan sa aming na tinatanong ng mga pasyente is namamana ba daw ang epilepsy? Okay? Well, heredity or genetics, no, they play a role. in many cases of epilepsy. Usually, mas common ito among your generalized type of epilepsy. In recent years, genetic links to some form of focal epilepsy has also been found. No? There is usually a slightly higher than usual risk, no, for siblings to develop epilepsy, since there may be genetic tendencies in the family for seizures and epilepsy. Baka kasi nakuha din nung kapatid mo yung the same genetic abnormality na nakuha mo sa parents mo, no? And however, most children of people with epilepsy do not develop seizures or epilepsy. But since genes are passed down, it is a possibility. So ang epilepsy, dapat tandaan natin, hindi siya nakakahawa. Okay? This is not a contagious disease. And people cannot catch it like yung typical na parang flu o butsipon na pag natabihan mo yung pasyenteng may ubutsipon na hawakan. Hindi ho ganun ang epilepsy. Kasi madalas yan, lalo na yung mga ibang nanay kasi pinagbabawalan nila yung mga anak nilang walang epilepsy na makahalubilo sa mga kalaro nila or mga kaskwela nila na may epilepsy. Sasabihin nila na, naku, wag kang makikihalubilo dyan kasi baka mahawa ka. Hindi po totoo yun. Okay? So, ito pa rin yung isang common, no? Will I always have seizures? Panghabang buhay ko na hubang dala itong sakit na to. Actually, about 6 out of 10 people diagnosed with epilepsy, they can become seizure-free within a few years with proper treatment. Emphasize on proper treatment. Many of these will never have any more seizures, and for the rest, some will have occasional breakthrough seizures, or some can even still feel the side effects of their medications. And a small number of patients will continue on to have uncontrolled seizures despite medications. Usually, yung outlook natin in the first year for a newly diagnosed patient with seizures, in about 5 to 6 out of 10 people will be seizure-free after using the first medication. No? So, that's about 50 to 60%. They will become seizure-free and their seizure can be controlled after using the first medication tried. No? And a second seizure medication may help another 10 to 20% of people become seizure-free. So, ibig sabihin, yung iba mga kailangan ng mga pangalawang gamot, no? Para makontrol yung seizures nila. In 25 out of 100 adults, or 25%, can still develop further seizures kahit nadagdagan na yung gamot nila. In children with new onset seizures, about 70 to 80% will become seizure-free within 2 years. No? And however, uncontrolled epilepsy can still be seen in 9% of children, followed over for a number of years. Doon naman sa mga outlook for people with seizures and epilepsy at any point in time, about 60 to 70% of them may get control of their seizure after a certain number of years. But we don't know if this means complete control, no? If this means complete control. Sabi nga natin, even for those na mention ko yan earlier, even for those na na-label na natin na resolved yung seizures nila, may risk pa din na pwedeng magkaroon sila ulit ng seizures. No? And at least 30% with epilepsy at any point in time may have uncontrolled seizures. And up to 50% with epilepsy may report bothersome effects of their seizure medications. So ano ba yung mga factors that may improve the chance of you being seizure-free? No? Number one is yung having a positive response to the first 1 or 2 seizure medications. Pag easy to control yung seizure mo, the likelihood of you becoming seizure-free after several years of intake of your anti-epileptic drugs, mas mataas siya. Those persons with epilepsy na walang history of brain injury or mga congenital malformations in their brain also have a good chance of being seizure free, no? If after several years they have normal neurologic exam, nag-normalize yung EEG nila, then again, that's one of the criteria that we follow na baka sila yung mga pwedeng matanggalan natin ng gamot eventually. If they don't have any family history of epilepsy, then again, that also increases your chance of becoming seizure free. And having an unknown cause of epilepsy likewise increases that chance. So, will I have to stay on seizure medications all my life? No. If your seizures go away, you may be able to come off your seizure medications. But I have to emphasize, it should be with your doctor's advice. Over the years of my practice, marami na akong na-encounter na ganito. No? Siyempre, kapag nagpapakonsulta, you give them an idea of what it's gonna be like in the next several years. No? Kadalasan sinasabi natin, there are some patients after 2 to 3 years of taking the medications, we eventually are able to wean them off from the medications. Ang nangyayari, after that consultation, babalik sila sa'yo after 3 to 5 years na. Yun pala, hininto na nila yung gamot, tapos nag-seizure breakthrough. Kasi hindi tama or hindi guided ng doktor nila yung pamamaraan ng pagtanggal nila ng gamot. Okay? So, has to be emphasized that this decision should be worked together with your doctor. So the length of time a person is seizure free before stopping his medications depends on many issues, no? So the longer time a person is seizure free on medication, the better is the chance that these medications can be taken off, no? And more than 50% of children usually outgrow their seizures, no? And people who have had surgery for their epilepsy, they may become seizure free, no? And they may come off their seizures after the surgery, but in some of these patients, they may need to stay on their medications to prevent the seizures from coming back even after epilepsy surgery. So what if I still am having seizures while taking seizure medication? Ito kadalasan yung sinasabi ko, okay? These anti-epileptic drugs are not miracle drugs. Hindi yan paracetamol that after you take it, 30 minutes after, mawawala yung lagnat mo. Hindi siya ganun, no? If you continue to have seizures while taking your medications, there are several questions that you need to look back on and answer, no? Unang-una, tama ba yung diagnosis? Is your diagnosis correct? Do you really have epilepsy? Okay? Kasi paminsan, depende rin kasi no, sa pagkakadescribe ng sitwasyon and whatever, nagkakaroon din naman ng chance na baka yung minamanifest mong symptoms ay hindi pala talaga epilepsy. So you need to go back and your doctor and you need to discuss again, diba? Why is your medications not working? Tapos, sabi ko rin kanina, diba? Yung seizure type, yung klase ng seizure meron ka, malaking malaking factor yan para sa pagdedesisyon, no? Kung anong klaseng gamot ang dapat ibigay sa iyo. Kasi kung halimbawa meron kang isang type ng seizure pero yung gamot na binigay sa iyo ay hindi akma para doon sa seizure type na meron ka, definitely hindi magwo-work yung gamot na yon. At magko-continue ka pa rin magkaroon ng seizure kahit iniinom mo regularly yung gamot, no? And then you also have to take into consideration, can you tolerate yung side effects ng medications that you're taking, no? Baka mamaya dahil nahihilo ka pala, hindi mo sinasabi sa doktor, kapag pala tinitake mo nahihilo ka or iba yung pakiramdam mo. So ang ginagawa mo, hindi mo iniinom yung gamot on time or nagpapalya ka kasi masama yung pakilasa mo. Pagkainom mo ng gamot, pwedeng maging sanhi yun kung bakit nagsi-seizure ka pa rin kasi hindi regular yung intake mo. Those are the things that you have to discuss with your doctors as well. So pang-apat, no, ito very common. Alam naman natin na ang Pilipinas ay hindi masyadong mayamang bansa. Kaya mo bang bilhin yung gamot na inirereseta sa iyo? O kaya available ba lagi yung gamot na yon, no? Sa butika na malapit sa inyo. Kasi kung hindi at hindi mo kaya, kadalasan nangyayari imbis na, for example, yung gamot mo, you have to take it 3 times a day. Pero dahil hindi mo nga kayang ma-afford to take it 3 times a day, yung iba, para lang masabing iniinom nila, binabawasan nila na without their doctors knowing, no? So ginagawa nilang once a day instead of 3 times a day. Again, hindi niya makokontrol yung seizures mo. So kahit uminom ka ng gamot pero mali yung pamamaraan ng pag-inom mo ng gamot, maaari ka rin magkaroon pa rin ng breakthrough seizure or magsi-seizure ka pa rin, hindi pa rin makokontrol yung seizures mo. And lastly, do you know how to take the medicine? Sinusunod mo ba? Yun nga, yung payo ng doktor kung paano siya inumin. So, importante talaga na bago ka lumabas ng clinic, no? Doc, clarify ko lang po. 3 times a day ko po ito inumin, ano? Isang tableta sa umaga, isang tableta sa tanghali, isang tableta sa gabi, no? Yung ibang majority of the medications yan may specific interval dapat. Pag sinabing every 12 hours mo siya dapat i-take or every 8 hours mo siya i-take kasi may epekto pa minsan din kapag nahuhuli or masyado mong na-advance yung pag-inom mo ng gamot. So, gaano kaseryoso ba ang pagsi-seizures, no? Ang pagsi-seizure. Most seizures usually they end on their own, no? Huwag kayong magtaka kung paminsan kahit nagsi-seizure sa harap ninyo ng doktor niyo, yung anak niyo o yung pasyente ninyo, hindi sila nagpapanik. Okay? Kasi kadalasan po talaga most of the seizures end on their own. Pero importante rin, siguro I'm sure naririnig nyo to, paulit-ulit sinasabi ng doktor ninyo, you have to time the seizures, no? Kasi importante yung haba ng seizures. Most of the seizures usually mga less than a minute, 1 to 3 minutes at the most, no? And usually it will stop. Kahit wala kang gawin, kahit hindi mo siya bigyan ng gamot or hindi mo siya, usually humihinto yan. But in certain conditions kasi, nagkakaroon tayo ng mga atake na mas mahaba dito sa usual, no? Kapag nagsi-seizure na siya tuloy-tuloy ng mga 5 minutes, 10 minutes, then you have to be very alert to bring that patient to your nearest hospital. Kasi baka mamaya nagsa-status epilepticus ang pasyente. Ito yung isang kondisyon na isang neurological emergency na kadalasan importante na maidala kagad sa pinakamalapit na ospital ng pasyente kasi may tendency na baka humaba pa lalo yung atake at hindi huminto, and that can pose a lot of problems for these patients, no? During some seizures, people can also injure themselves, no? And develop other medical problems that may be life-threatening or life-threatening emergencies, gaya nga nung sinabi kong status. Kadalasan kasi, lalo na kung halimbawa biglaan kasing nangyayari yan, ano? So paminsan, paano kung halimbawa umaakyat siya ng hagdanan pag nangyari ito at nag-seizure siya bigla, may tendency na pwede siyang mahulog at ma-aksidente siya. And that can bring about a serious injury, no? The overall risk of dying for a person with epilepsy is usually about 1 to 3 times higher than for the general population, no? May mas mataas na konting risk, no, na posibilidad po ito. There is another condition, yung tinatawag nating sudden unexpected death in epilepsy. This is a condition that is likely the most common disease-related cause of death in persons with epilepsy. Hindi siya frequent, no? Hindi ito madalas nangyayari, but it can. And people need to be aware of this risk. So sometimes your doctors will discuss this with you, no? Kasi you need to be made aware. Okay? Okay. So people with epilepsy, so what are the other myths that we need to debunk, no? People with epilepsy, sinasabi ng iba, are mentally ill or emotionally stable. Well, actually, epilepsy is a functional physical problem and not a mental one. And because of the chronicity, however, of this illness, some people may experience yung sinasabi ko kanina na psychiatric morbidity, no? Such as anxiety, depression, or aggression. And sometimes, yung side effects ng ating anti-epileptic medication may also likewise cause these symptoms. Pag ganyan po, importante na kailangan po ninyo na idulong idulog sa inyong doktor kung may mga simptomas kayong ganyan na nararamdaman. Okay? So another myth is people with epilepsy, sabi nila, aren't as smart as other people. On the contrary, no. Epilepsy has little or no effect on a person's ability to think. Pero sometimes, syempre, during the seizures, may short period of time following the seizures na medyo parang off sila, no? And sometimes, because as a side effect of certain medications that they're taking, it may have some effect. But kadalasan po, hindi ito ibig sabihin na pag may epilepsy ka, pwede kang maging, bobo ka or wala kang kakayanan para maging magaling. No? In fact, I have patients who have graduated valedictorian of their class. No? Maraming persons with epilepsy na nagiging doktor. May mga epilepsy, merong mga pasyenteng may epilepsy na nagiging lawyer, no? They can also have they can also be outstanding, no, in their profession. So sabi din ng iba, people who have seizures can't handle high pressure or demanding jobs or can't go to school. Marami na po kaming na-encounter na ganito, no, na-diagnose namin may epilepsy, tapos malaman-laman na lang namin na ay, pinahinto siya ng pag-aaral ng magulang. So tanungin mo, bakit? Kasi may epilepsy siya. Pero hindi naman ho ibig sabihin na pag may epilepsy, hindi na po sila pwedeng pumasok sa eskwela. Persons with epilepsy can go to school, can have jobs, no, and they do. And most schools and profession can and should accommodate these people with epilepsy. No? Sabi nila na pag nagsisisure daw, masakit. So marami akong na-encounter na ganito sa aking yung mga magulang ng aking mga pasyente. Masyado nilang ini-spoil yung mga bata. Konting kibot lang, parang nagpapanik na sila na napatakbo lang ng konti yung bata, hahabulin na nila, tapos pagbabawalan, pagagalitan, ay, don't do that, ganyan. No? Kasi natatakot sila na pag nag-seizure, masasaktan lalo yung pasyente. No? Yung kadalasan, the person usually are unconscious during the time of their seizure. So, and paminsan altered yung awareness nila. So, kadalasan hindi nila nararamdaman yung nangyayari sa kanila. However, no, after their seizure, sometimes some of these people may feel some form of discomfort in a form of, let's say, muscle pains, or kung nakagat nila yung dila nila habang nag-seizure sila, syempre masakit yon. Okay? So, ito pa, sabi ng marami, di ba? Ito, panahon pa ito ng, kahit sa Biblia, sinasabi yan, di ba? People with epilepsy are cursed, no? Epilepsy is actually not a curse. Hindi yan punishment. Hindi yan punishment na binigay ng Diyos, no? Kasi iba, kaya nagka-epilepsy yan dahil ang nanay niya mangungurakot o nagpa 5-6 or whatever. It's not. It is a medical condition. Okay? And you have to understand that people with epilepsy can continue to have a normal, productive, and happy life. No? The importance of getting proper treatment and adherence to medications cannot be overly emphasized. No? And epilepsy should not be a barrier for achieving. Okay? So, a person's quality of life may be affected, syempre, by the frequency and severity of their seizures, sometimes because of the side effects of medications and their other comorbid conditions, no? And you also have to understand that some types of epilepsy may be more difficult to control than others, no? But again, let me emphasize, this will not be, ang tawag dito, this should not be a limitation because some of these factors you can actually modify them, no, to make your life better. So let me end with this slide, no. I borrowed this from one of our lecturers during the epilepsy camp at PCMC. No, I have epilepsy, but please don't call me an epileptic. No, sometimes I just don't feel like myself at all. And sometimes I have a fit or I fall down. I'm soon back on my feet again, and then I can get on with my work, and I feel fine. Okay, so with that, we end this lecture. Fortune, if you give me just an opportunity, no, to promote. Um, the first week of September, September 1 to 7, is actually the 19th National Epilepsy Awareness Week. No? And the Philippine League Against Epilepsy has a lot of program, no, that we have prepared, no, for everybody, no. We are currently conducting a photo and video contest, and this is actually open to all persons with epilepsy as well as their immediate caregivers. So, yung hong contestant na pwedeng sumali po dito are the patients themselves o yung mga immediate caregivers nila. For example, yung tatay ng isang pasyenteng may epilepsy or so you have to And then we will have ito yung nakakatuwa na bagong i-offer namin. From September 1 to September 3 at 2:30 to 3:30 in the afternoon, magkakaroon po tayo ng tinatawag naming epilepsy serye, no? Ito po para siyang yung parang interview kung nanonood kayo ng mga tipong Boy Abunda ganyan. We will be talking to 3 epilepsy exemplar awardees, no. They will share their life, they will share their challenges and during this time, no. And meron ho kaming inimbitahan na isang person with epilepsy na isang banker, meron isang person with epilepsy na entrepreneur, siya ho ay may-ari ng sarili niyang kumpanya, at meron din po kaming isang pasyenteng may epilepsy na eventually naging life coach. No? So this is from September 1 to 3 at 2:30, and this will be broadcasted live sa aming dalawang Facebook page, yung Philippine League Against Epilepsy at saka yung Beyond the Shake na Facebook page. No? We also have parang a series of webinars also for healthcare professionals. This is open not only to neurologists or specialists, no? It can be for any healthcare worker dealing with persons with epilepsy. Okay? Maraming salamat po. Thank you, Fortune.
Maraming salamat, Dr. Jean, for that very interesting topic that we had this afternoon. Ang daming natutunan yung mga viewers natin in terms of the myths and the facts on epilepsy. And just to continue with this, I'd like to acknowledge one of your friend as well, Doctor, who's with us right now. And she's got a good insight, no? Si Dr. Malen Ortiz. Ang sabi niya, anti-seizure medications are not illicit. Some are controlled substances because of possibility of abuse. Totoo yun. And this requires special prescriptions from the doctor. Tama yun, ano?
Yeah, shout out to Dr. Ortiz. Maraming salamat sa suporta.
Yeah, doctor. We actually have lined up a lot of questions for this, doctor, but for the interest of time, I'll be choosing some of the very relevant questions that we can put across. A question from the audience says, what if I'm planning to get pregnant? Will I stop taking my medication for epilepsy?
Um, sa pagbubuntis, no, there's
Mhm.
really, one is, of course, even before you get pregnant, doon pa lang po sa time, especially kung halimbawa you've had your epilepsy na, no, bago ka pa kasal or whatever, or bago ka pa mabuntis, alam mo na may epilepsy ka and you're taking medications, and you are planning to get pregnant, importante na kasama mo ang doktor mo. Your neurologist should be with you so that he or she can guide you, no? Because it doesn't mean that you have to stop your medication, no? Because stopping your medications abruptly can actually cause more problems, no? Pwede kang magkaroon ng withdrawal seizures because of stopping your medications abruptly. So what is important is you talk to your doctor, no? And tell your doctor na, oh, nagpaplano po akong magbuntis. Ano po bang dapat nating gawin? Ano po bang kailangan ko bang palitan yung klase ng gamot na iniinom ko? There are a lot of factors kasi that needs to be considered, no? Pero kung halimbawa, hindi mo alam, buntis ka na, no? Tapos hindi mo alam, buntis ka pala. Tapos umiinom ka ng gamot.
Mhm.
Again, don't stop the medications abruptly. Go back to your doctor and ask your doctor what is the best way, no? For you to deal with it. Ano yung pinakamagandang paraan, no, para magkaroon ito ng less effect on, kasi ang kadalasan namang kinatatakot natin dyan is baka magkaroon ng epekto dun sa batang nabubuo sa sinapupunan mo, 'di ba?
Mhm. Yeah.
Kadalasan yun naman. Although there are risks, and this can be discussed with your doctor. So let your doctor plan this with you, no, and
Mhm.
deal with it with you. Don't stop your medications abruptly. Don't. Please don't.
Okay, doctor. Now, here's another question regarding sa medication. What about taking supplements? What's your take on this?
Okay, gaya nga ng sabi ko, no, actually I mentioned it in one of my slides, di ba? Those over-the-counter medications or yung mga lumalabas na mga supplement ng mga alam mo yun, yung nakikita mo sa internet or whatever, before taking this on, or any medications for that matter, no, you have to clear it first with your doctors, no. Sabi nga natin, di ba, because you are on anti-epileptic medications or anti-epileptic drugs, this supplements or this whatever drugs that or medications that you are going to take, you have to clear it up with your doctor. Ako lalo na kasi syempre mga pasyente ko medyo bata, 'di ba? I actually talagang tell the parents of my patients to, before starting any medication, kahit na naireseta na sa inyo dati
Mm.
ng pediatrician ninyo, before you give it again, please, no, inform your doctor, no, ask them what is best for a particular condition, no. And kung halimbawa naman bago yung doktor na pupuntahan ninyo at hindi kayo kilala o hindi kilala yung anak niyo, or kung kayo yung may pasyente, you have to inform that doctor that you are taking medications for your epilepsy, so that when they choose the medication, no, that they will give you for a particular condition, iti-take nila itong consideration kung magkakaroon ba ito ng drug interaction dun sa current medication that you're taking.
Okay. Doctor will end with this insight from one of the viewers, and ang sabi niya kasi that people who are suffering from epilepsy lose self-confidence and self-esteem. What's your take on this?
Like any other disability or any other condition, your condition should not define who you are. Yan yung lagi kong sinasabi. Your condition should not define who you are. Okay? ikaw ang gagawa ng sarili mong buhay, ikaw ang gagawa ng sarili mong landas na tatahakin. Okay? Just to share with you, I am a person with polio. No? But despite that condition, I was able to get over that. Alam mo yun, nandyan yung pinagtatawanan ka, andyan yung tinitingnan ka, paano ka maglakad and stuff like that. No? But this shouldn't hamper you from achieving your goals to make the best person you can be. So your condition should not define you.
That is a very powerful message.
That is related to the first slide that I showed you, that quotation from Maya Angelou.
Yeah, maraming salamat Dr. Jean for coming over and guesting to our episode, this Health Talk. Ang dami namin matutunan. Ang dami pang mga tanong, Doctor, but siguro I'll just send this to you via email so that you can run through it.
Sagutin sa thread.
Correct. Doctor, we're also interested about the activities that you just shown earlier, no, yung 19th Epileptic Awareness Week. Maybe you can also share it with us and we can post it through our Zach at Zydos Facebook page para mas marami pa makakakita sa announcement na yun.
Yes, papadala ko sa iyo, Fortune. Huwag kang mag-alala.
So guys, I hope that we have learned a lot of important facts about epilepsy. It is important that we know this illness because who knows, if you come across someone who is suffering from epileptic seizure, you already know what to do at hindi dapat sila katakutan. Epilepsy is manageable and epileptic patients can live their lives just as a normal person does. Sabi nga ni Dr. Jean, don't be afraid. Huwag kayong magpadala sa mga kung ano man yung sinasabi ng iba just because of your condition. And that's it for today's episode of Health Talk. My name is Forts. Have a great weekend, everyone.
Thank you.
Zach at Zydos brings you a patient care program, Health Talk, a lay forum that gives various information on illnesses and diseases with advice from medical experts. Join us live on Facebook.